Hi everybody, this is Kaylee, and today we're going to be talking about one of the worst possible downfalls of having unprotected sex, sexually transmitted disease, chlamydia. Chlamydia is a sexually transmitted disease caused by the bacterium strain called Chlamydia trachomatis. And unfortunately, this particular STD, when left untreated, can lead to serious, long, and short-term negative effects on reproductive health. So today, we're going to find out A, how common is chlamydia and what are its symptoms? B, well, if you are infected, then what? What kind of treatment is available? And lastly, if left untreated, what kind of complications can arise from being infected with chlamydia? As with any sexually transmitted disease, if you are sexually active, you're at risk for contracting chlamydia. According to the CDC, however, chlamydia is the most highly reported STD in the country right now. Actually, according to a recent survey, there are over 2.2 million U.S. citizens between ages 14 and 39 that are currently infected, most of whom don't even know this. That's because 50% of women and 75% of men who have chlamydia don't have any symptoms whatsoever and are unaware that they're infected. Now, for those who do have symptoms, usually appearing 1 to 3 weeks after infection, this is the not so fun part because they can include any of the following: discharge from the genitals or pain while urinating, general bleeding and pain, and for some women, fever, nausea, and pain during sex. Chlamydia itself can be contracted through oral, anal, or vaginal sex and can manifest itself in the vagina, penis, throat, and anus. No bueno. So, if you are infected, well, then what? What kind of treatment is available? Being a bacterial disease as opposed to a viral disease, chlamydia is fairly easy to cure and treat once diagnosed. The CDC suggests that all women under 25 should go for regular yearly testing, all women over 25 with new sex partners should be tested, and all pregnant women should be tested for chlamydia in an effort to diagnose, treat, and prevent adverse effects from arising. So, once diagnosed, chlamydia can be treated with a single dosage of the antibiotic called doxycycline, and this usually lasts about a week. And during this time, most doctors suggest that all infected persons and their partners abstain from all forms of sexual activity. So, if left untreated, what kind of adverse complications can arise from exposure to chlamydia? Generally, treatment is fairly easy, and chlamydia can be cured. However, due to the fact that most men and women with chlamydia are completely unaware that they are infected, many adverse effects and complications can arise before knowledge of the infection is even, there. And generally, for women, these effects are more serious. Men rarely, if ever, have complications from exposure to chlamydia. However, in some rare instances, the infection can spread to the epididymis, which is the tube from the testes that carries sperm, causing general pain and, in some rare cases, sterility among men. For women, however, a range of complications can occur since chlamydia can spread from the cervix to the uterus or fallopian tubes. In 40% of untreated cases among women, these patients contract PID, or pelvic inflammatory disease. PID can lead to permanent damage of the reproductive organs, which in turn causes things like chronic pain, infertility, or pregnancy outside of the uterus, called ectopic pregnancy, which can be fatal. Also, in pregnant women with chlamydia, the disease can be passed from mother to child during a vaginal birth. Now, for a newborn baby, this can cause a myriad of complications, including things like pneumonia and pink eye. In very rare instances, arthritis, skin lesions, swelling of the eyes, or urethra can also be caused from exposure to chlamydia. For all you gentlemen out there, I want you to stay with me for a second and imagine you're Johnson and this book. Now, that wouldn't be too comfortable. Join me for a future video where we're going to discuss the clap, more commonly known as gonorrhea. Did you know that 75% of Americans carry the herpes virus? Join me in a future video where we'll discuss this and more facts about herpes. Well, folks, if that's not enough incentive to wrap it before you tap it, use a condom, then I don't know what is. This is Kaylee. Thanks for joining me on our discussion about chlamydia. Please rate my video, leave me any comments that you'd like, and don't forget to subscribe. See you later. 1 to 3 weeks after being infected. Damn it, after the infected. Zombie craze. Stop. Yeah, I'm breaking. Discharge from the genitals or pain while urinating. Damn it. Genitals.